How important is this shift now to really focusing on centers like this versus some of the bigger mass vaccination sites in the state?
Yeah, it's what I've been calling the hub and spoke model that we need to think about. So you need these mass vaccination sites, which are the hubs, to do the high volume vaccinations. And then we're the spokes on that wheel that could really get into these communities, provide local services with people that people recognize and people can relate to. I think one of the important things is be patient. I think we're going to see a flood of people coming in who are going to be the yeses, and that's great. But then there's a large portion of this population who are really going to be on the fence and maybe a soft no or maybe a hard no. And I think we have to make sure that we maintain the capacity and make sure that the vaccine's available for as we're getting this information out and we're talking to the residents of this community. And when they say yes, we have to be open and available and make sure that we get those vaccines in people's arms.
When it comes to the undocumented community here who are so vulnerable, but they might be intimidated by seeing National Guard here, what has been the calculation when it comes to that?
Yeah, it was one of the things we were concerned about when the state offered the National Guard to us. But working with our board of directors and other community partners, they really helped us with developing social media posts and other ways to communicate that these National Guards men and women are really here to help this community, and they're not serving in any particular government role, and they're not here to check any immigration status. And many of them come from the community as well, so they speak the language and they know the culture and they know the unique circumstances that our patients are in. But I reminded them of that, and I told them make sure we give them the best customer service that we could possibly give them, and of course smile with your eyes.
Even under the mask.
Even under the mask.
Oh, smile with the eyes, even under the mask. Dasha joining us now from Boston. Dasha, tell us more about the biggest roadblocks health officials and places like this are dealing with as they try to get minorities vaccinated and get to populations that are just being left out here.
Hey, Allison, we're coming to you from a very windy day here in East Boston. And look, the answer to your question is not a simple one, and that is part of the challenge, right? These communities, they differ greatly from zip code to zip code. We saw that firsthand yesterday when we visited several different centers in different neighborhoods, and that's really why these community health centers are looking to take the lead. These are hyper-local institutions that reflect the communities and the people that they serve. They've been ingrained here for decades now. They've basically been like the Swiss Army knives of healthcare and information here. So they feel like they can really help with that confidence issue, the issue of trust with a lot of these communities, that they want more information, but they want it from people that they know, from people that they can relate to. Manny Lopes, who heads up the East Boston Neighborhood Health Center, we were with him yesterday, and he was recognized on just about every street corner. These centers are also deploying what they call vaccine street teams, folks who are going out, talking to their neighbors and really having that one-on-one conversation to better understand the concerns. I want you to hear from one of those individuals. This is Sandra. She is going out into the neighborhood, listening to her neighbors. Take a listen to some of what she had to say.
So some of the concerns that I hear is so for folks who don't speak, English is not the first language, I am finding that there's a lot of fear regarding the vaccination and how that information is going to get transferred to government agencies, how that information is going to get utilized. But on the other hand, for English-speaking folks, I'm finding that there's just a lot of fear and mistrust about the process, specifically around how quickly the vaccine was developed. So a lot of the feedback that I get is, I want to wait. I don't want to be the first in line.
So they can really understand what the fears are, so they can help bridge those gaps and break down those barriers. But Allison, aside from the confidence issue and the trust issue, there are also systemic problems that predated COVID-19 that have now been exacerbated. For example, life expectancy. One of the neighborhoods we were in yesterday, Roxbury, has a life expectancy of 59 years. So when you look at eligibility, that's for 65 plus, you're missing a whole lot of vulnerable folks there, Allison. These are the things that the leaders here really want thought about more. They want more attention paid to these sorts of issues in the vaccine strategy going forward here. Allison.
Really important stuff, Dasha, in a very windy Boston, Massachusetts, but I'm glad to see you don't have gloves on. That means it's pretty warm in Boston for this time of year.
That was a mistake. I should have had gloves on, Allison.
Oh, no. All right, get inside and get warm. Dasha, thank you.
See you soon.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.